How do you scale a private dental practice into a nationally recognized, patient-first powerhouse without losing sight of what matters most? Dr. Roger Pecina didn't copy a model, he redefined what a dental practice could be, built on trust, leadership, and patient-friendly dentistry. Now, with his son, Dr. Parker Pecina, he's sharing the blueprint. This is All on 32, where practice ownership meets purpose.
Hi, welcome back to the All on 32 podcast. I'm Dr. Roger Pecina.
And I'm Dr. Parker Pecina.
Today we're going to talk about one of our goals in our practice. It's what we call patient-friendly dentistry. People always ask, so what does that really mean? It's funny, patients never ask what it means, but other doctors ask what it means,
They do.
right?
Yep. Yeah. I mean, that's something that give us a history on it. That's a phrase that you coined a long time ago. And it's something that for some reason, dentists hadn't really thought of.
It comes from the standpoint of, we always felt, look, everybody who has a practice thinks whatever they're doing is the right thing. Mm-hmm. And if you're happy with what you're doing, you're comfortable with what you're doing, that's great. Keep doing it. But what we were looking at, it was, what can we do for the patient that is different than what they were maybe getting at another office? And a big part of it was just a staff and, your business assistants and the people, the greeters in the lobby, and just how are you presenting yourself as a business when they walk into your building? So many times I hear patients say, I go to this place, but they're not friendly. I go to this place, they don't help me with anything. Yeah. I just hear that all the time. So what I wanted to do was I wanted to take the burden of responsibility of everything other than their teeth away from the patient.
Right. So I think a good way to describe it, you hear patient friendly now, and most people say, well, yeah, obviously it seems like a no-brainer, but you have to understand that it wasn't always like that. It might be, back then it was probably more compared to like you going to a hospital now, right? You had an appointment, you saw a doctor, you made your next appointment and you left. And there was nothing outwardly friendly about that exchange, right?
Yep.
And what you did was you decided you wanted to be one of the first guys out there to tailor the entire dental experience, making it an experience, and tailor that to the patient and where they're at in their life in that moment, and making sure that it was the best experience that they had at your practice.
Yeah, that covers everything.
Yeah.
Everything about the appointment. Because what we're really striving for here is, that's just good marketing. Mm-hmm. Because what you're doing is you're creating a happy patient. And most of the time, that has nothing to do with the procedure.
No, they just want to be heard.
They want to be listened to. They want to feel they have a voice. They don't want you to stand there with their back to them and you're on a computer. They want you to sit down and talk to them like you would if you're out having a cup of coffee or a beer. It takes effort. You don't have to have a great personality to do it, because it will grow when you become comfortable with it. But like when the patient comes to the practice, this whole thing about giving somebody a clipboard, that used to just drive me crazy. I go to a lot of offices I go to now for my own medical care. They're still handing me a clipboard, and it just offends me. And it's like, well, why aren't you helping me with this?
Yeah. I am a paying customer.
Yeah.
Right? You go to a diner. It's, you want that experience, right?
Right.
You want your server to be very friendly and talk to you. And this is not just you personally in your practice, but this bleeds into every aspect of your practice. Like you said, it starts with the phone call. when they're calling to become a new patient and get evaluated at your practice, or make the appointment to be seen for an emergency, or even just ask you questions about your practice to see if it's a good fit for you. And I think it starts with how you build your staff, right? If you have people that are answering the phones that don't believe in your patient-friendly dentistry concept, then they're not going to be a fit for you, and you're not going to get what you want, because that patient's going to have that bad experience on the phone. And if they still end up coming in for some reason and don't go find another practice, you're already back. You've got to turn it around, and you've got to get them to not believe in you all over again. But if your staff is doing that for you before their butt hits that seat, that's a totally different thing. You know how many patients I hear sit down and be like, man, I just want to say,
Right.
like, from the second I walked in here, I said, you guys are so friendly.
Yeah.
I've never had an experience like this anywhere else.
Yep.
And that's what it's all about. You've done 80% of the work right there. You're not even talking about dentistry yet.
Right.
And they already have the confidence in you that you're the right fit for them.
You have impressed them so much to the point where you've given them such a better experience than they've had in the past.
Mm-hmm.
They're going to already assume that your dentistry is as good as it
Right.
can be.
Yep.
You don't have to prove anything to them except to do the procedure, do it efficiently, as quickly as possible, and painlessly as possible. That's your part. But people say, well, what about my insurance? They're always asking questions about insurance. How much work are you doing for the patient to figure out what their insurance benefits are at?
Right.
We need to know. That's something that I need to know what those benefits are going to be. Because if I'm going to make them up a treatment plan and they want to know, hey, how much is my insurance going to pay? I have to at least give them some idea or some estimate. I think the other thing that comes into the friendly thing is I always say that if you care about the patient's money more than your own, you're going to make a lot of friends in dentistry.
Oh, yeah. Yeah, I love having that conversation with every patient I talk to. When a lot of them, if you can have a patient come in and you can be one of those dentists that offers your patients all these options. Well, here's all the things we can do, right? And then you let your patient choose. In reality, it's your decision. You're the dentist. They want you to make the best decision for them. And when you tell them, like, hey, you know what, we can probably get another filling out of this tooth, and instead of being the guy that's going to do the crown to collect the money and increase your production, they're going to listen to that, and they're going to finally realize, wow, I'm with somebody that doesn't care about how much they're making on this, and they're going to do the best thing for me. And I use that a lot in the room with a patient, saying, I'm doing this because I think this is the best move for you at this time, with the diagnosis of the tooth and where you're at and the most predictable outcome. That's another word I like to use a lot, is the predictability of outcomes. There's a lot of things you can do that can cost a lot of money. There is ideal and recommended treatment. There's unrecommended treatment. There's not doing anything. There's all these different options. There are dentists out there that won't listen to patients' concerns, and they're going to say, this is what needs to happen. In reality, it's a lot of times it's not what needs to happen. What needs to happen is what's best for that person in that chair, not what's best for your wallet.
There's a lot to be said for code diagnostics. I like to get the patient involved in the discussion.
Mm-hmm.
My job to create patient-friendly dentistry is for me to be an educator. I need to be able to get them to understand, through the terms that they can understand, where their problem really is. This is a very casual conversation when you have that. What you're doing is, during this time, the patient is determining whether they like you as a person.
Mm-hmm.
They don't know about your dentistry. But if they like you as a person, you've just got 90% of the battle. And there's a lot less chance of something coming up, going bad. You can impress them as a doctor once you get your hands in the mouth and how skilled you are. But everything else that goes around that is going to determine whether or not that patient becomes an advocate for your practice.
Mm-hmm. Yeah, you said earlier how patient-friendly dentistry is it's a marketer. It really is. It's still a real thing. Instilling patient-friendly dentistry in your office and making it the best possible experience for the patient is important, but the dividends it pays is the free marketing you have from people leaving and saying, just like they said to me in the chair, and that was the best experience for me walking through the door. Those are your foot soldiers, right? That
Yep.
you always talk about. Those are the people out there that, how many people leave the dentist and they have a conversation with somebody late in their day and said, yeah, I had a dental appointment earlier today. And they say, oh yeah, how did that go? And most people are like, oh, I was at the dentist. How do you
Right.
think it
Yeah.
went? Or they say, man, it was actually surprisingly amazing. The
Right.
people there really cared about me. They
Yeah.
listened to my concerns. And I had the greatest dentist. They really explained everything to me and they got me involved in the treatment. And then they figured the best way for me to use my insurance benefits for this. They figured it all out for me. They did everything for me. It was a seamless experience and I learned a lot from it. And we've got a really good plan moving forward. You don't need to see that on a commercial.
No,
Your patient volume goes through the roof.
Yeah, it's the cheapest form of marketing you can have is to create the best patient experience. And that's why for the last 15 years, we've seen 500 new patients a month in each of our offices.
Yeah.
That's a month. That's 1,000 new patients a month. Patients aren't as loyal as they used to be.
Mm-hmm.
They'll change dentists really, really fast. You have to give them a reason to want to stay with you. You also have to give them a reason to say good things about you and be a member. They're an extended member of your team.
Yeah.
You're trying to create that person to do that. Now, if your whole staff isn't dialed into that, it's a problem.
Yeah. It starts with your staff. Again, one bad egg can, you have to get rid of the toxicity in your practice. It has to be the culture that you create that breeds success and makes everybody want to work hard. You have to, there's life happens outside of our work, but you have to turn it off when you get to the office, and you have to be a leader. And again, it's very important that it starts with your staff, that everybody's on the same page, that everybody believes in what you were trying to accomplish. And like you said, the amount of new patients we see, a lot of that also goes into, we are like a full service dental practice.
Right.
So, you might be able to implement some of these things in your practice to increase patient volume, but a lot of our volume is also seen because we don't really say no. We don't refer a whole lot of things out. And again, that comes because we have a lot of very experienced doctors that can do those things. So it is important to grow your skill set at the same time, to be that doctor that can do all of these things for your patients, because now they're going to start relying on you. And then that's another way you're going to get a lot of those or word of mouth referrals, because, go over there to see Afdent. They took care of all of my needs. And that's a very important thing. It goes patient friendly. The amount of things that you offer in your practice and having everybody on the same page.
It's very frustrating to a patient to wait maybe 2, 3, 4 weeks for an appointment and then be referred out without anything being done. So, if you can have a wide range of skills, that keeps people in the practice. They are so thankful for that. That has been, I think, one of the biggest things.
Yeah.
that they need surgery, they need root canal therapy, they need orthodontics.
You have to see them through the entire treatment.
And that way they know, hey, I just need to go there. Dentistry is expensive. Try to hold the fees down as much as we can, keep them competitive, but at the same time, oftentimes when a person has a serious dental problem, there's something else going on in their life that's not working out either.
Yeah.
So you kind of piggyback that onto each other, and there is absolutely no shortage of patients in this country. We have a shortage of dentists. We have a shortage of hygienists. Mm-hmm. We have a shortage of being able to deliver care. So you have to make sure that when that when that patient does come in, that you can do the things that they need to have done so that it doesn't seem to them like it's a chore. I don't want to go somewhere and then tell me, well, you need to go somewhere else and have this MRI. Then you need to go somewhere else and have this CT or whatever it is. The more that you can do, the easier you can make it for the patient. That's what really patient friendly is.
Yeah, that is the take home point. That is, they have a one-stop shop where they can go to and they can count on you to figure everything out for them. I know if I have a doctor's appointment somewhere else and they tell me I got to go see another place and I have to call that place and I have to, send them the referral and I've got to do all this work, I would love it if they can do it all for me. That would make my life so much easier. We're all busy, and like he said, life happens outside of being a patient. So you try to take advantage of them being in your office, and again, any chance you get to get them to understand that this is a place they need to be, that's what keeps them coming back. And obviously growing your skill set, again, I think is very important. If you don't have, if you're a newer doctor, you don't have that super expanded skill set of doing a lot of surgery or root canals, you need to find the time to get that experience. If you work for another doctor and you're an associate, you need to make sure they understand how this can bring in more foot traffic in your office is doing root canals and doing more surgeries. I think it is awesome to go to the courses, but I do believe you need to find the mentorship, the people that can teach you these things so that you can do it yourself. And it takes time. You're not just going to be amazing at it right out of the gate. You have to learn. You learn from your mistakes. That is how you get really good at figuring out what not to do or getting yourself out of a jam. It does happen. Accidents happen, and you have to be prepared to get yourself out of it. And that's where you learn to be confident in what you're doing, and you start saying yes to a lot more. I think another thing is working in like same day treatment. If you have that built in your office, if you don't, I think that's something that you should consider. Striking while the iron is hot, while the patient is there for their first appointment. And my dad always says that patient might leave and then they get a flat tire or their fridge stops working and you're not going to see them for a little bit of time. So get some dental work done. That's honestly just as important as those things, if not more important, because it's for their health. Some people have disease in their mouth, and if you can treat that in the same day while they're there, then they might see how important it is to you that they get work done and that they improve their health.
As far as treating same day patients, you have to really get yourself in a mindset that this schedule you're so happy with, and you've got it all set up exactly the way you want it. You've got it pre-blocked into this and everything. You have to have more flexibility. You've got to decide, is the schedule for me or is it for my customers?
Yeah, it's their convenience.
That's the question. And everybody wants to make a schedule for them. But yet, when they're not hitting their numbers or they're not doing enough dentistry, then they're the first ones that want to complain about it.
Mm-hmm. That I think that like the convenience of your schedule versus convenience of your patients. I think most people try to organize things as convenient for their staff, but everything you're doing should be for your patients. Every single thing. So it's at the patient's convenience of what works for them, not what works for you. And you need to accommodate. Accommodation is what shows them how committed you are to serving their best interests and serving their health. I think that's the most important, one of the most important things. So again, all of these things together, I know it seems like a lot of things, but in the end, patient-friendly staff from the front door through the back door, okay? Getting your patients to trust and believe in you goes from accommodating them, making sure that all these different parts of your practice all the wheels are spinning together and everybody's on the same page and that you don't have any toxicity in your practice, and being there for your patient and accommodating them and what works best for them.
And don't assume anything.
Don't assume anything.
Don't assume your staff that you think is doing a really great job for you. Make sure you check on them very, very often
Yeah.
to make sure that they're doing exactly what it is you want them.
Yeah, and that is your responsibility as well.
Yeah. That's about it for today. Appreciate you joining us, and we'll see you next time. Thanks.
Thank you.